This program was made possible by a grant from the UCF College of Health and Public Affairs, which promotes excellence in undergraduate and graduate education, research, and community service in health-related professions and public affairs.
Hello everyone, welcome to For Your Health. I'm Charna Davis-Wiese. Ed Highland is out on assignment. On today's show, you may know it as stuttering, and you may think of it as a childhood affliction that people outgrow. But as we'll learn today, fluency and speech disorders can be quite complex. Treating babies can also be complex, which is why we now have the baby simulator. That's also coming up on today's show.
I'm Alicia Callanan Mandigo. A speech and language therapy clinic credits UCF with its success. I'll have that story.
Treating babies, especially in an emergency room setting, can be very challenging. Emergency room physicians just don't see as many babies as they do adults, which inspired the birth of the baby simulator.
He cries, blinks, and even breathes on his own. He's not real, but he sure looks it. This baby simulator is the newest way to train doctors.
A 4-month-old male is brought by his mother to the emergency department.
This is a real simulation. The medical residents don't know what's wrong with the baby, but they have to find out. After giving air, performing an intubation to open his airway, and learning about his history, they correctly diagnose the infant with shaken baby syndrome.
It's very important for us to actually experience this before we experience a real thing. I think it's a golden part of our training.
I think he's as lifelike as you could make him without him being real.
Pediatric intensivists create different scenarios on a computer program. That info is fed to a microprocessor inside the baby and then to a monitor that displays the infant's vital signs.
We can manipulate this child's physiology, meaning the way the body works.
Doctors can check his pulse and change his heartbeat, blood pressure, and breathing rate. They can give him an IV and medication. And he's the size of a real infant with skin that's pliable. Compare the new simulator to this old one.
We've been working very hard to move from using just the plastic mannequins into a really almost living, breathing type of device to do some of these resuscitations. It's very exciting.
Exciting for the medical residents of today, who will soon be the doctors of tomorrow. This is Cynthia Demas reporting.
Future baby simulators are expected to be even more sophisticated. There is even talk of developing a fetal simulator. Perhaps you've had a child at home who, for no apparent reason, began to stutter. It's very common, and for most kids, a normal phase in speech development. But for others, fluency and speech disorders can indicate there's something else going on. Joining me now is Dr. Martine Vanryckeghem from UCF's Department of Communication Sciences and Disorders in the College of Health and Public Affairs. Thank you, Dr. V, for being here. And we also want to say that you were just recognized as a newly elected fellow of the American Speech Language Hearing Association. Congratulations.
Thank you.
I think if I went through your whole list of kudos, we'd probably waste all of, not waste, but take all of our interview time. You teach and you do programs internationally here in the States. We're really lucky to have you here.
Thank you.
Now, first of all, it's a word that we've heard so many times, maybe have met children, people, actors, and use the term stuttering. But that's only one small part of a big group of fluency disorders.
That's correct.
Is there a way to describe what they are so people can understand the complexity of it?
Mm-hmm. Stuttering, of course, is the type of fluency disorder that is best known to everybody. And even in the field of fluency disorders, the name stuttering is used a lot, I think overused, because there is more to fluency disorders than just stuttering. But most researchers and clinicians agree upon that stuttering is the fact, and I'm sure people recognize that sounds or syllables come out over and over again, like paper, or sounds will not come out, like block,
Right.
or sounds are prolonged, like I would like some fries, okay? These are the typical behaviors that you see in a person who stutters. There are, however, many other fluency disorders, such as cluttering. Cluttering, for instance, is typified by the fact that people speak very, very fast, and your first reaction is, what is this person saying? So that very fast speech rate, often a slurred articulation, borderline unintelligibility are the characteristics of cluttering. Then somebody might have had a stroke and suddenly becomes disfluent. So there are neurogenic disfluencies, and again, that is a very large group. Then certain people might have experienced some psychological trauma and as a result become disfluent. We could put that under the umbrella of psychogenic disfluencies. So they are all different types of disfluencies. People with Tourette syndrome are often disfluent. People with Down syndrome. We are now also looking into people with autism, Asperger's syndrome. Many people with different disorders also show some disfluencies. The question is, are they the same disfluencies as we see in people who stutter? And the answer to that is often no. That's why I think we shouldn't label everything as stuttering. We shouldn't label it the same way. We also shouldn't treat it the same way.
And the challenge is trying to assess what the situation is.
Absolutely.
And what the problem is.
Right.
Now tell us about the BAB, the behavioral assessment that you work with.
The behavior assessment battery is, as the word says, a battery of tests. It's composed of several tests. We have the tests for children as well as adults. They relate to what is known in the field as the ABC of stuttering, meaning the affective, behavioral, cognitive component, and I shouldn't say of stuttering, but of the person who stutters, because there's more to the person who stutters than only the stuttering. Stuttering is just one minor component. It's one component of the B component, the behavioral component. So there are the stuttering behaviors, but aside from that, there is another B, another behavioral component, which is the use of coping behaviors. Many people who stutter will try different ways of getting out of their stutter, or in anticipation of stuttering, will use avoidance behaviors, use synonyms, circumlocutions. So that is a B component, behavioral component, which is an aspect of the behavior assessment battery. Another one is the affective component, the emotional component. Many people who stutter have great worry, anxiety, fear, negative emotional reaction relative to particular sounds and words that for all of us are so neutral. You know, when we say fries, we don't even think about it. For those people, because of past negative experiences, those words, those sounds have come to become fearful of. The same with situations. I remember I went to McDonald's, I had to order this hamburger. It didn't come out right. So situations become fearful. So the affective component is also part of what we investigate by the
So
BAB.
how you feel about what's going on around you can make it even worse. In fact, I read something,
yes.
I'm trying to remember the man's name, but it was a paper on, I think it was John Harrison, and it was called Why Talking is Easy While Being Someone Else. And in the end of it, are you familiar with it? He wrote, what I found out when I worked through it and had therapy was that there was more to me than I thought there was. Mm-hmm. That his whole image of himself and really his whole life was affected by stuttering.
Absolutely. We have no idea what an all-encompassing disorder stuttering is. It impacts people's social life, professional life. One of the classic stories that people who stutter will tell you is, for years I have taken a job for which I was overqualified, but I didn't take the other job because of the fear that I would need to talk more and as a result stutter more. So in children, they might not answer questions in class that they know the answer of because of the fear that they will stutter. People might not socialize as much as I mentioned because of the fear of stuttering.
And the self-esteem issues involved in it as well.
Oh, absolutely. And so it is something that we need to assess all those components, and we need to deal with them in therapy as well. Treatment for people who stutter should deal with more than just the stuttering, but also the negative emotional reaction, the negative belief system, because often people have a negative belief system, a negative attitude about their own speech. Those are all components that need to be addressed in a well-versed, multi-dimensional treatment for people who stutter.
It's almost like a metaphor of not being comfortable in your own skin.
Oh, yes.
Because it's how you present yourself to the world.
Absolutely. And so one of the things we do, and that's where hopefully in the future also virtual reality will come in, is we need to desensitize people relative to those sounds and words that now have become that they have become fearful of, or the situations that they are afraid of. Via role play, through role play, we will get more comfortable in ordering in the restaurant. In the communication disorders clinic, I will play within our clinic setting, I will play the waitress and my client will order. And then the final step is going to the restaurant and being able to order in a more fluent way.
You've practiced.
Oh, yes.
They've practiced it.
Yes, absolutely. And we need to practice it in a hierarchical way, from the role play to eventually going to the restaurant. And so I hope that in the future, virtual reality can serve us there as an in-between step.
Dr. V, we'll be right back, and when we do come back, will they grow out of it? I don't know. Don't go away. Welcome back. We're talking with Dr. Martine Vanryckeghem, and we're talking about fluency disorders and stuttering. And you know, this is something that is very personal to me because I have a little boy who had a very difficult time talking. You know, when you talked about at first speaking very quickly, the cluttering, he did that, and then it morphed into PHs and THs and Fs and Rs, and everyone said he'll grow out of it. He'll grow out of it. He'll grow out of it. And a year passed, and 2 years passed, and some he did, but the R's he never did. And in school, the pediatrician, he'll grow out of it. And now he's 9, and thankfully I met you people, Dr. Whiteside and Charlotte Harvey, and you, and he's in your clinic, and he's 9. He never grew out of it. And I wonder how much time we have wasted, and I'm sure we're not the only family in this situation.
Not. Absolutely not. It's I call it an international problem. You know, I've been in the field since 1977, first 12 years in Belgium before I came to the States. We see it all the time, whether we are dealing with speech disorders or language disorders. The children come to us too late, you know, those very precious years when children are 2, 3, 4 years of age, when they learn to talk. That's when something goes wrong or doesn't develop the way it should. That's when at least we should be able to take a look at the child, at least do some screening or do some initial testing.
Now, if they're not doing it in the schools, which doesn't seem like they are anymore, what's your suggestion to a parent? How do you know when it is just baby talk or it's a problem?
Yes. Well, I think very often parents are good judges as far as the speech and language of their children are concerned. And when they think this somehow doesn't sound right to me, well, chances are it probably isn't. So my suggestion would be bring them to, in case of speech and language, to a speech language pathologist for an initial screening. Relative to stuttering, for instance, I have seen young children at the age of 3 and 4 3 times. Each time I said to the parents, I will never say to them, oh, don't worry, be happy. No, I said, well, at the moment, there's nothing I see that is worrisome to me. However, certainly relative to stuttering, there are certain things to look for. Is there stuttering in the family? I will definitely ask the people, the parents, to come back. Also, we see more stuttering in boys than girls. So if it's a boy who seems to have a tendency for stuttering, I, again, most likely will say, please come back. But typically, I say to the parents, at this moment, there's nothing I see that is worrisome. I do see repetitions, but they are slow rather than the fast, tense repetitions that we might see. But come back in 6 months and I'll take another look. Or I will say, bring in a video when there is a speech at home that you consider to be stuttering. Try and videotape your child and bring me the video. I'll take a look at it.
And really the truth is, if you have therapy, it's not going to hurt.
No.
There's really nothing lost if you try to fix it.
It's only gained.
There's only a gain.
As soon as we can start, the better we are off, because these are very precious years, and it happens all too often that we see children at the age of 5 or 6, 7 or 8 who come in for speech or language disorders, and we always think the same. Why did we not see this child any earlier?
And it's so hard to watch them. I mean, to see my little guy trying so hard to do something that came so naturally to his brother and his sister. He's working very hard at it, but I have to say, in 3 weeks, the progress he's made is pretty amazing.
Yes. Oh yeah.
It's pretty amazing.
Yeah, it is. So certainly, again, the earlier we can see these children, the better we are. And I really would like to ask every pediatrician and family physician to, if there is any doubt that there might be something wrong with speech or language, please refer these children. We are the people who are specialized in speech and language, and we would like to help the children and their parents early on, as early as possible.
Speaking of children, tell me about Kitty Cat.
The Kitty Cat. Well,
with
you know,
two T's, not 2 T's.
Our youngest baby among the tests that I co-author, it is an attitude test for preschoolers and kindergartners. For many, many years in the field of stuttering and fluency disorders, even researchers and clinicians thought, well, young children are not aware of their stuttering, and they're certainly not concerned about it. In the meantime, we have found out that is not the case. We know that children as young as 3 are aware of the fact that they stutter in general. And now, by means of the Kitty Cat, we even know that children as young as the age of 3 have a negative speech-associated attitude about their speech. And knowing that, it is important that we deal with this early on in therapy. Again, we need to do more than just focus on the stuttering, but pay attention to the negative attitude, negative emotional reaction that surrounds stuttering.
Right, because even in your own home, there could be an older sibling making fun, or a parent thinking it's something they're doing on purpose, and it makes the whole cycle worse.
Oh yes, definitely. And it's always another major component in the treatment of people who stutter, to educate the parents, the siblings, and if we are dealing with a child who goes to school, also the children in class. Because by educating the other children in class, we can already greatly diminish the teasing and the bullying. Now these other children have been informed as to what stuttering is, and they have learned about those famous people who also stutter, and it's very neat now, it's cool, they know about stuttering, and that already greatly reduces the teasing.
We talk about how we really need to catch this early. How about the adult who has never been treated? Is there hope for them? Is it ever too late?
I would say it's never too late, and we can always try and improve the fluency. We can modify the stuttering in many, many different ways. So the majority of the people who stutter have had one therapy or sometimes many therapies as young children. And so the majority come to us with a kind of a baggage of therapies that have failed. Once in a while, indeed, we do see an adult person who comes to the clinic who has never had any speech therapy. And yes, we can absolutely try and improve the fluency and also work on these other components that deal with the negative emotional reaction and the negative belief system that this person has about his speech. And again, work on desensitization and help the person in his daily environment.
And also, for more information, they could also contact the National Stuttering Association?
Yes, absolutely. As a matter of fact, the Communication Disorders Clinic houses the Orlando chapter of the National Stuttering Association.
Great. Dr. Martine Vanryckeghem, thank you so much for joining us.
Thank you.
Appreciate your coming here. For one UCF graduate, speech pathology offered a chance to work with children, something she knew she'd like as a career. What she didn't expect was for that career in speech pathology to spawn a highly successful business.
I am a learning girl.
Oh, you're a learning girl, yes.
Yeah.
Yes, you are.
I love history and science, and reading. Those are my favorite subjects.
Did you
8-year-old Sophia is as cute and as engaging as they come. Her need for speech and language therapy almost seems like a footnote in her story, but it's not.
Our daughter was about 3.5 when she was diagnosed with a progressive sensory neural hearing loss. And within weeks of that diagnosis, she was also diagnosed with a partial complex seizure disorder. So you hear that as a parent and you do feel that your life is kind of over. You walk in through these doors and you definitely feel like they get it. And
like you're comfortable.
You're very comfortable. And it's one of these things where they treat your child like one of their
children.
Now, why do you think the baby's going to want to eat?
Because that's all they do is screech.
But why?
This is Florida Speech, an independent speech pathology clinic started by UCF graduate Melissa Milani.
I thought I would go into physical therapy, but I knew I wanted to be in a therapy field. And then a friend of mine suggested that I go look at the Communication Sciences and Disorders Clinic because they did speech therapy there. And to be honest, I'd never heard of speech therapy. I didn't know anyone that had ever been in speech therapy or met a speech therapist at all. So I thought, okay, I'll go check it out. And they have at the clinic at UCF two-way mirrors, and so people can observe and watch the therapy sessions. So I went and I observed a little bit as part of an elective course that I took, and I really liked it.
In 2006, Milani started her own practice as a one-person operation doing home health visits. She now employs 15 therapists and is part of a network of therapy practices.
Never in my wildest dreams would I have thought that just a few short years after first starting this, would it be this big.
Milani says she owes it all to UCF, where she earned her bachelor's, her master's, and is now working toward her doctorate. The majority of her staff are also UCF grads, and she says that's been a big factor in building her business.
Without a doubt, without a doubt. Their program is, I obviously think very highly of it as a graduate of it myself, but their program is just impeccable. They have excellent teaching, an excellent clinical program as well as academic program. They're constantly staying on the cutting edge of technology and research, and the graduates that they're producing, just bar none, are amazing.
Just as the children who come here are finding new pathways for communication, speech-language pathology is also trailblazing as it moves into the future.
When UCF decided they were going to have this PhD program, it's a PhD program focusing on language and literacy, especially for school-age children. I thought this could really have a very good impact, not only for the business, but for the children that we serve.
My mother bird sat on her egg.
Good. Now show me when you say sat.
Sat.
Very nice. I know it's hard with those teeth.
Children like Sophia.
The bed you wear.
Sophia's always been a bright, articulate kid, but I think just being surrounded by a bunch of clinicians who truly get it has allowed her to embrace her differences and not feel as though she's singled out because of them. As a parent, you want nothing more than your child to fit in, and they allow that.
I'm Alicia Callanan Mandigo for your health.
Since many children need a multidisciplinary approach to their therapy, Florida Speech is part of a cluster of pediatric and therapy-based practices. That's all the time we have for today. I'm Charna Davis-Wiese. Thank you for joining us. We'll see you again next time on For Your Health.